Welcome to This Week in Health IT. It's Newsday. My name is Bill Russell, former healthcare CIO for a 16-hospital system and creator of This Week in Health IT, a channel dedicated to keeping health IT staff current and engaged. Special thanks to Sirius Healthcare, Health Lyrics, and Worldwide Technology, who are our Newsday show sponsors, for investing in our mission to develop the next generation of health IT leaders. We set a goal for our show, and one of those goals for this year is to grow our YouTube followers. We have about 600 plus followers today on our YouTube channel. Why, you might ask? Because not only do we produce this show in video format, but we also produce 4 short video clips from each show that we do. If you subscribe, you'll be notified when they go live. We produce those clips just for you, the busy health IT professional. So go ahead and check that out. We also launched Today in Health IT, a weekday daily show that is on todayinhealthit.com. We look at one story each day and try to keep it to about 10 minutes or less, so it's really digestible. This is a great way for you to stay current. It's a great way for your team to stay current. In fact, if I were a CIO today, I would have all my staff listening to Today in Health IT so we could discuss it. Agree with the content, disagree with the content. It is still a great way to get the conversation started, so check that out as well. Hopefully you've heard our big announcement. We are introducing written content onto our site to accompany our existing 4 podcasts. I'm personally excited about this, and it really allows us to reach a different group of people than we've reached in the past. I hear stories about people who listen to our shows on their daily runs or their commute to work, if those things still exist. But I also know of professionals who would rather skim an article than listen to an hour-long podcast. So I'm excited to say, starting next week, we're going to be hosting news write-ups of our shows, as well as feature stories on thisweekhealth.com. And we want to hear from you. So please shoot us a note and tell us what you think. If you're excited, if you have questions, or even if you're interested in becoming a contributor. One of the things I am really excited about with this move is we opened up all new avenues to allow contributors to come in to the platform. So we're going to be able to share articles that you write. We're going to also be able to potentially have you host podcasts and submit them to the show so that we can put them out there to our community. And we are really excited about that. So thank you for listening and joining in our mission of raising up the next generation of health leaders by amplifying great thinking to propel healthcare forward. WWT is a sponsor of today's show, so if you want to find out more about them, you can do that at wwt.com/thisweekinhealthit. Now, let me explain that a little bit, because it's www.this-week-in-health-it. So www.com/ the name of the show, This Week in Health IT. It's Newsday, and today we have Dr. Eric Quinones, the Chief Healthcare Advisor for Worldwide Technology, with us. Welcome to the show, Eric. It's first time on.
It is the first time on, Bill, and thank you for having me. I'm looking forward to diving into some really good discussions.
Yeah, me too. You sent over some great stories. I mean, clearly, you really want to go after where digital transformation and disruption's happening in healthcare.
Yeah, it's interesting. I have conversations with a lot of my colleagues. I've been at this for 21 plus years in healthcare IT, clinical information systems in one way or another. And, in all this time, clinicians have, we know what we want. We want, things to be less frictiony, more smooth. We want to be able to interact with our patients. We've known all these things for years. And finally, I think we're starting to see real traction with some technologies. I mean, the pandemic is, it took a pandemic, right? Unfortunately, to help realize some of these things. But yeah, I think right now the time is ripe, and we're seeing some really great, and I don't like to say disruption in technology, or I like to use more like evolution, right?
Yeah.
So, yeah.
Well, but the evolution happened so fast, right? It went from, telehealth is a great example. It went from, I don't really want to do telehealth, it's not a part of my practice, to, okay, we're going to do telehealth, to, you fast forward like a couple months and they're saying, look, I need one-click telehealth visits with my patients. I need to text them a link. They click on it and they show up. And by the way, that needs to be integrated with I mean, you see how far that went in such a short period of time. It's really amazing. That's why I say disruption from time to time, because That's an amazing amount of movement in healthcare.
It really is. And, you know, where would we be if we didn't have the COVID virus? If we didn't have, SARS-CoV-2, maybe we'd still be having these discussions pandemic in terms of virtual care. But I think we go through these experiences. We have to pivot quickly, and then it wasn't good enough even when we got it. Now we want it better and quicker, faster. So that's kind of human nature. So I think that's good. Yeah,
absolutely. So 21 years. Tell us how you got to this current role as chief healthcare advisor. How did you get into the technology space?
Oh, that started early on. So I was at Dartmouth Hitchcock, and we were working on a project there to actually build our own EHR. So we were building the ambulatory side of the house. Now they're an Epic shop, but we were doing that. So I was involved as a liaison, working with clinicians and working with the engineers and doing a lot of QA process with that rudimentary EHR at the time. And mostly it was a glorified, documentation and lab system at that time. So, but it was interesting because I saw the writing on the wall for me, and that I knew the way we were practicing medicine had to go in this direction some way, somehow. But yeah, and then from there, so I have an ED background, but from there I really got involved with Allscripts. So Allscripts Healthcare Solutions, and I was their clinical director for several years. Had also taken some opportunities to work with some consultancies, Deloitte, Slalom. I was also the director of clinical information systems over at Healthcare Partners, which you probably know very well. Yeah. So, and that was prior to the DaVita acquisition. So that was very interesting because we did the first de-install of Epic, because we had both Allscripts and Epic. So it was the first de-install in history of Epic, and that's a whole nother story. But anyway, we made that happen, and it was a financial decision, of course. And then I had an opportunity to work with a startup over in Houston that really works in clinical decision support in the hospital space, identifying patients that may be decompensating early, and so to let the right people at the right time know about these patients and within their particular workflows. So yeah, I've been on one side as on the provider side, as the administrator side, on the vendor side. I've had a little taste of everything.
Wow, which is phenomenal. I look forward to the conversation. We can go in a lot of different directions. We have 6 stories. As I told you earlier, it'll be a miracle if we get through them. There's a handful that are knitted together because they're Amazon stories. You have a story here from Healthcare IT News around a new group that is talking about hospital at home initiatives. We have the Fierce Healthcare story, what healthcare can learn from big tech, which is always interesting to me. The Humana teams with Mercy to expand access to virtual care, and that's an interesting partnership and an interesting way that Mercy has gone to market, I think. I have a Stat News story, which is also an Amazon story, so we'll knit those two together. That's just the 18 new locations that Care Medical, which is Amazon Care's partner, has filed to operate in those states. We have, what else do we have here? We have, money for nothing, making sense of data collaboration, which is a really good story. I don't know if we'll get to that one. I hope we do. And then there's a story about transitioning back to the office, which raises some questions for IT. So 6 really cool stories. Do you want to try to kick us off with one of these?
Sure. How about, basically what hospitals can learn from big tech, Amazon, sure, et cetera.
Yeah, let's go there. Why don't you tee it up and we'll head into it.
Yeah, so, I think Amazon and others, Apple and Google, they're all really, I would call these non-traditionals, right, that are getting into the healthcare space, as we know, and they are really, pushing the envelope and kind of, putting traditional healthcare providers on their heels. So one, they have the technologies, and two, they have, I think, if we're speaking particular about Amazon, they have the experience in terms of, you know, evolving. I like to say evolving, not disrupting, but evolving different industries, retail, grocery. Think of anything you go on Amazon, especially during the pandemic. Those that weren't using Amazon, they definitely had that experience, I'm sure. And it's a seamless experience for the most part. So that customer experience, they really have nailed down, and being able to have the data, I think, has really helped them. So they see that, there's a play obviously in healthcare. They've tried it with Haven Health. I think they're way ahead of the game there. We can have that discussion as well. But yeah, they're placed really well. And I think, again, like Apple as well, I mean, they just know that the patient experience is so critical. I mean, the client experience and consumer experience is so critical, and they really focus on those things. So that really positions them differently.
Well, let me see if I can throw something out and see if it resonates with you, which is, Amazon, Apple, and some of these other big tech players, they are consumer centric. I mean, and Amazon is notoriously, consumer centric. Everything they do is around the consumer and how to make their lives better and how to make it more efficient. Health systems are provider centric and have been for decades. And and I'm not the first to say this, obviously there's others. This is the famous quote from Geisler's former CEO, who's now at Google, who said, the waiting room is indicative of everything we think about the patient, which is, you will go into this queue and wait for us, and when we're ready to see you, we will we'll call you, because we are maximizing the time of the provider. And so everything is about the provider. So that I think is the most stark contrast between big tech's approach, and they're always thinking, how can we make this better for the consumer, and health systems approach, which is, how do we make this better for the provider? And I'm not against making it better for the provider. I'm just saying, is there a gap there that health systems have to close in order to not be, evolved, I guess is what you're saying. I would say disrupted, but evolved.
Yeah, I think there is a gap, you know, but I think they're becoming painfully aware that the gap exists. We as patients, I think of, like, when I used to go to the doctor when I was a kid, or when I'd go with my grandparents to the doctor, it was like, it was that old school relationship, right? Just like you said, you'd wait in the waiting room for, your 45 minutes past your appointment time, if not longer. The ED is worse, by the way, as you know. So, so it just, that's what we got used to. And I think what's happened, especially as the consumeristic demographics have changed, that's not what consumers are used to anymore. Again, they're seeing these experiences they're having, such as the with retail applications that they're using, that financial applications they're using. It's very seamless. I mean, you can walk near a Starbucks. You're not going to get a coffee, but you can walk near it, and all of a sudden your phone shows you your favorite drink, and you're like, oh, that's right. And maybe you do want a coffee. So it's predicting what you want, right?
Thank you for reminding me that I'm thirsty and I wanted one of your coffees.
Well, come on over, fly on over to LA, and we'll have one.
No, I mean, that's how they think. They're like, we don't know who's going to walk across our front door, but we're going to have the technology set up to remind you of our relationship, remind you that we're here to serve you, and we have something that you want and you need.
Right. And that I think is the secret sauce, right? And I think, again, the expectation of patients that they're consumers, they're expecting that now. And I think, healthcare organizations are realizing that. And you're seeing this in, and revamping digital front doors and that kind of, play. And that's very important. They need to do that. I'll give you an example. So at St. Jude's, we did some really amazing work with them. So you think of a children's hospital, right? A cancer, specialty hospital, people coming from all over the world. Well, they had a problem, and like, how do we make their experience, desirable, less friction based? And they brought us in to help them with that, and we created an award-winning app. It won 2 Webby awards. And what the application does, and even if they don't have, the families come in and they don't have the technology, they're provided the technology while they're there. But it wave finds them from literally from the airport to their hotel to the hospital, wave finding within the hospital, shows them where their appointments are. It connects them with their care teams. In terms of the patients, the children, it allows them to connect to other children that may be going through the same thing. And then again, they may be, the patient themselves, the child may be separated from their family because their family went to go to have dinner, and they could make reservations from this app, go have dinner, and the child can speak to their family while they're having dinner. And the child, it's a whole different ball game now. And I think that just as consumers, we're expecting that.
Yeah, it's interesting. We've seen all those technologies, and you just gave a great use case at St. Jude where it's taking wayfinding, it's taking open table and reservations, and it's just taking all those things, knitting them together and saying, how, if we're going to be consumer centric in healthcare, what does it look like? And that's just one example of what is possible when we step back and say, what does it look like? Let me tee this up a little bit, because you have, and I'm going to steal one of your stories. So you have the story of a group that launched a hospital at home initiative. Let me read a little bit. So founding members of this coalition include Amazon Care, Ascension, Dispatch Health, Alera, Caring, Intermountain Healthcare, Home Instead, Landmark Health, and Signify Health. Among the group's policy priorities: expand the services covered in a home-based setting, retain important hospital without walls site of care flexibility, support home-based hospital services, ensure equal access for seniors through fair reimbursement for home-based evaluation and monitoring codes, advocate for bundled payment models for extended care in the home, encourage greater flexibility for home-based care services to meet commercial and Medicare Advantage network adequacy standards. And so there's, so this group is advocating for that set of policy initiatives, which is, hey, the home is a great place, and there's a lot of statistics to support it. In fact, I think they have some of the statistics in here. Let's see, Moving Health Home members point to an array of statistics that say bolster their case for more technology-enabled virtual care. They point, for instance, to an AARP study that saw that 3 in 4 adults 50 years or older preferring to age in their homes and communities. And that's absolutely true. Beyond that, the quality and cost improvements are apparent, they said, noting CMS estimates that show home health care in Medicare saves at least $378 million a year. That's like real money. And there's a couple other statistics in here. So we know that the home is the next frontier, and so does Amazon. That's why they're a part of this initiative. You just shared the story of what we can learn from Amazon. And one of the things Amazon did to the malls and the stores that were all thriving at the time when they came up with their model is they just skipped the malls. They didn't put a facility in each city. Now they've gone back and done that after the fact. But what they did is essentially they went to the home. They said, do people really want to go to the mall? Do they really want to shop for something, find out it's not in this store, go to the next store, and then go to the next store? And it turns out they placed a bet on it, and they were right. So let me tie that with the last story on Amazon, which is Stat News story. And we alluded to this earlier. Care Medical, Amazon Care's partner for providing Amazon Care as their concierge level service for their employees that they were offering in the Washington market. They've now filed to operate in 17 more states. Okay, so They are, and they will essentially concierge level service. They'll meet you in your office. They'll meet you in your home. They will care for your family wherever they're at. They will get you same day medications shipped to your home. And, you know, if you have a serious problem, they sign deals with organizations like City of Hope. And it's similar to what Walmart did. And they signed deals with, with Mayo and Geisinger and others for specialty care. And so you have these interesting things evolving around the home. And I think people have asked me, is Amazon going to build a hospital? And the answer is no, they're not going to build a hospital. They don't want the high acuity care, but they absolutely are going to start delivering care in the home. And that care in the home is going to be essentially hospital rooms in the home. The acuity of care is going to continue to rise that we can deliver in the home. And that is that's the chink in the armor that they've identified and said, look, we're going to have thousands, if not hundreds of thousands of hospital rooms across the country. We're not going to pay for a single building. They're all going to be in the home, and we're going to technology enable those, and we're going to partner with people to deliver the care. That's what I'm seeing. I mean, that's my crystal ball. How off do you think that is? Do you think there's another way of really interpreting these things?
It's a great question, Bill. You know, your crystal ball is pretty spot on. Matter of fact, I think we got it at the same store. Yeah, I think you wrote something in December and I responded to what you had wrote. And it was basically talking about some of the things we are talking about here with Amazon in terms of where they're positioned. And I think in my response, I was just saying that, you know, can you imagine, like, again, this is the quintessential one-stop shop place to get everything done, your primary care, your, you know, Amazon pharmacy pill pack, right? You get your, you know, drone delivers your medications. I may be, you know, going a little far out there, but
yeah,
hey,
durable goods as well. You can get your, you know, your crutches and anything else you might need.
right. And, you know, oh, my groceries and etc. Right? It's all one-stop shopping. And then you have Alexa in the house, you know, that can maybe with ambient, you know, technologies and things like that to be able to, if there's falls in the house and things like that, or you need help, or, you know, and Alexa's just reminding you to take your medication or reminding you to, you know, take your blood pressure, etc. Again, with the IoT play as well. So I think they are positioned really well to be the juggernaut and to come out, I would say, of the Coliseum a victor in this play for sure.
Yeah, it's going to be interesting. All right, so I'm gonna push on you a little bit here, and I'll think about it as well. So if I were at a health system today, I really have to sharpen my consumer-centric skills. I have to have a team that's good at interacting with patients and consumers, right? And finding out what they're looking for. One of my favorite stories on this was we spent 6 to 9 months working on our portal. We were developing a custom portal, and it had, you know, and my gosh, we spent all the time working on how the medical record was going to appear. And it finally dawned on somebody, you know, we should talk to consumers and find out what's important to them. And sure enough, how getting the medical record and how it appeared was like number 8 on their list of 10 things that they prioritized. And number 1 was scheduling, as you would imagine. Number 2 was communicating with their doctor via text messaging. And I just remember when we got that information back, I was like, it was like that old V8 commercial where you hit your head and go, wow, that makes perfect sense. I can't believe we were spending this much time. But I mean, that's my advice to health systems. Start interacting with the patient, ask them what they want, and develop that consumer-centric capability, and then figure out who you need to partner with and build in order to start meeting some of those needs.
You hit it right on the spot. You know, per usual. The one thing I think, you know, your example that you used from, this was at St. Joe's.
Yeah.
Okay. So at St. Joe's, I mean, you know, we know, and we don't know what we don't know sometimes, right? So, you know, and we tend to go towards what we know. And I think you know, organizations are getting more sophisticated and they're realizing, hey, how are other outside of healthcare, how are other industries doing this? How are they making their, consumer experience, platinum level? How are they doing that? And I would say they're really, like you just said, they're going to the users, they're going to the consumers, they're going to the patients, they're doing journey mapping, and they're asking them these things. What are the frustrations you're encountering in your experience, in your care journey? What are the things you would like to have? So when you think of like, and bringing that to, again, an experience to, let's say, digital front door, they would like to have, as you said, scheduling, and not just scheduling, being able to pick the time, the date, right, with their doctor. And maybe I have the option to do, am I going to be physically there, or does it need to be physically there? Can I do a telehealth visit? So I have that, again, one app to rule them all. And again, I could do my telehealth visit right there. They would like to be able to, obviously, prescriptions. They would like to do all those things that they need to do to get their healthcare stuff done, I think is really critical. And stitch those things together, as you said, with, people use different apps, but really bring it into one place. But you have to go to the patient and do that journey mapping with them, and not just the patient. Obviously, you should be talking to, the nurses, the doctors. Again, what is their experience and what are they hearing? And I think bringing that all together, I think, is extremely important.
Well, I think it's interesting that you bring that up, because I think that's the thing that keeps us from moving forward. We absolutely want to be clinician centric in our technology and the build of our technology. I mean, some of the stuff we've put in front of clinicians has been incredibly wasteful of their time and their energy. And so we want to be cognizant. But when you're talking about consumer things, it's disruptive to their current practice. It would be as if, you go to the purveyors in the malls way back when and say, hey, we're going to start competing with Amazon, and we're going to start doing shipping in this way and whatever. And they're like, the mall's full. There's people here every day. They're hitting our stuff. Why do we need to change? We don't need to change. And so you end up having these very long conversations trying to convince people that they need to change until all of a sudden the malls are empty.
Right. Yeah. I mean, so I think that the gap, or you want to see this, to reduce the gap and reduce the friction on both sides, is very critical. So again, we may have new interfaces or new experiences for the patient, but it has to, that's why I said, we need to talk to the clinicians as well, the administrators as well, family members as well, to really understand the journey mapping, so that we can really, whatever we're using technology for, technology, data, people, process, whatever we're doing, that it's going to help reduce the friction on both sides of the equation. So yeah.
I remember going into the Southern California market, and you were there. I mean, you remember this. So Kaiser came in a big way, and this is one of Kaiser's strongest markets now, Northern Cal and Southern Cal, but Southern Cal is a strong market for them. And they came in, their quality numbers were not that good. Quite frankly, they didn't hold a candle to us at first. And then they got better, and they reduced clinical variability. They did a lot of really excellent things. And then their quality numbers exceeded ours. And we're like, well, but nobody really wants to work there because they don't have the creativity and all this other stuff. And then they started hiring some of our doctors away. And people were like, hey, what's going on? Well, you talk to some of those doctors and they're like, hey, our quality of life's better over here. Mm-hmm. I'm like, wow, that's interesting how that just sort of snuck up on everybody. It was, hey, low quality, not a great place to work, to then all of a sudden, extremely high quality, great place to work. Well, they didn't have a hospital. Well, now they have a significantly huge hospital in Southern California as well. And I'm afraid that we're not taking some of these things serious enough, and it could just sneak up on us. And we just need to have honest conversations of, what does it mean to be consumer centric in our approach? And quite frankly, if you walk around and see a fax machine, you're not consumer centric. If you walk around and see clipboards, you're not consumer centric.
Right. Yeah, it's interesting, you bring that up because it reminds me when I was back at Healthcare Partners, one of the one of the initiatives I was trying to push was, okay, if we're going to compete with X, Y, and Z, it takes a lot of resources to find, good physicians and et cetera. So you go through that process. But if we're going to make that, we're making this investment, we're looking for those top flight docs and nurse practitioners, et cetera. Now, why would they come to, if we're going to pay them the same amount versus the competition, what differentiates us versus them? It's like, why would they want to come to us? So in other words, what I was trying, because I was talking about with this particular initiative was also retention as well. So how do we create an environment that is, conducive, that can reduce the friction for the physicians, that they want to stay if they're going to get paid the same, right?
Yeah.
So I think we missed that boat. I was working on some initiatives, and I think and that's when DaVita came in and they bought us up, and things just got really interesting then. And then, so if I were, again, a primary care doctor and I'm working, I'm seeing 30 patients a day and I'm staying till 7 o'clock at night, or I have I get paid X, and I have this other place that I can get paid X. Say I see 30 patients a day, but I'm leaving like 5 o'clock. That's a whole nother story.
We'll get back to our show in just a minute. The future of healthcare is powered by digital transformation. Organizations must leverage technology to solve complex clinical and business problems. WWT, Worldwide Technology, has real-world healthcare experience to build and execute solutions that push healthcare organizations past the status quo and towards the successful transformation of their business model. Together with Intel, WWT is driving innovations in telehealth, healthcare IoT, and data analytics and AI, making healthcare more connected, personalized, and intelligent. From strategy development to solution creation, WWT supports our healthcare clients every step of their journey. For more information, visit www.com/this-week-in-health-IT. That's the name of the show. www.com/This Week in Health IT with dashes in it. And now back to our show. So you pulled up a story from Humana and Mercy. Do you tee that up? Because I think Mercy's, their virtual hospital thing is pretty interesting, and it sort of lends itself to this conversation.
Yeah. Well, so with Mercy Hospital, Mercy Virtual, Mercy Health, they did something pretty unique here. And have you ever been to the facility? Have you seen that?
I haven't. So we're talking Mercy in St. Louis, and they have a virtual hospital essentially.
Yes. And so it's a hospital without beds, and it's quite amazing. I have been there, and it's one of the highest tech places I've ever been to in healthcare. So they are able to monitor patients either at home or in the hospital, and to be able to be proactive in their care. So they're seeing those particular metrics that they're following to be, again, like I said, proactive and instead of reactive with these patients. And they've had tremendous success. I'll be shameless here and I'll plug it. I mean, Worldwide Technology and Cisco, we were the ones that helped, Mercy Virtual do that. So, but with Humana, now they're basically working together now. So they struck this agreement, Mercy Virtual, and it's a value-based play, and it's pretty cool. I mean, they're like, Humana's like, yeah, take our patients, manage these patients like you do your own patients at risk, and we're going to have that arrangement. And Mercy Virtual has been able to show, from the article there, some really substantial, I would say savings, especially on on the value-based care model. They reduce readmissions, they reduce sepsis, they reduce stroke. incidents and things like that. So they've been really proactive and been really successful. But
Yeah.
yeah.
And so they have, it's a virtual hospital. They have 300 plus clinicians in that facility. They're doing 7/24 monitoring. It can be to the home. It can be remote ICU and that kind of stuff as well. This deal is Arkansas, Kansas, Missouri, and Oklahoma. I would assume it can be expanded beyond that, couldn't it?
Absolutely. I mean, think of, surgeons at UCLA doing surgeries in Ghana, right? It doesn't matter where. I mean, they can be remote and be monitoring those patients. And so, no, it can be just about anywhere. And I think it's interesting because I think we're going to see more of that. I mean, again, in my crystal ball, and why? We don't have the resources I think that we need to be able to care for a lot of these patients. And again, instead of having episodic care, especially for the patients that are home, episodic care, to have more longitudinal care, a continuity of care for these patients, especially with chronic diseases. It's so important to be proactive. So I think to be able to scale, right, to monitor a population, you're going to have these kinds of technologies to be able to enable that. So I think we're going to see more of that.
Well, and to be able to compete with Amazon or whoever else really tries to get a foothold in the home, Mercy's set up for this, as is Intermountain has something similar. And I think Mayo is also heading down this path. If I were an academic medical center, I'd absolutely be heading down this path. I think brands have an opportunity to win here, but they have to stand up these capabilities. And I think that's why what Hlopk is doing up at Mayo is so interesting to just keep an eye on.
Right. No, it's pretty exciting stuff. And I think, so the last company I was with, a company called Decisio Health, it's a startup in Houston. This is something that we were working on in a sense where we were able to create a dashboard, right? This is more for the ICU or for the med surg environment and for the ED. So anywhere in the hospital space, but we're able to bring the data, the disparate data, in a way that the clinicians want to see it at the bedside in real time. And again, each population is different. So your ED population may be very different than your, shock trauma ICU. So they may want to see different things, and they can see those things come up in real time. But then taking that model from, let's say, using a rapid response team to be able to monitor patients on the floor, because a lot of problems happen on the floor. These patients decompensate, and alerts and EHRs don't work, by the way. I mean, I've seen situations that you have to, log in to the patient's record and, the alert comes off and that patient actually had expired. So, and that alert was 2 hours old. So I've seen situations like that. So that's not an alert, hey, they already robbed my house, and now you get an alert, 2 days later. No, that doesn't help me. So, we were very proactive in alerting the right people at the right time about the right patient according to their workflows. So I think you're going to see these plays. And we moved it outside of the hospital, and we were doing work at OHSU and with GE Healthcare. And they have kind of built this model, a similar model, not just to monitor their hospital, but to bring that out to, other hospitals outside the network as a service.
So, yeah. I had someone say to me, it's, we have the physicians, this why won't big tech win? They're like, we have the physicians. I'm like, well, until they start taking the money, because once they take the money, they can hire the physicians. And they looked at me like, yeah, I guess that makes sense. Yeah, that is how it works. So I think this is one of the best plays I've seen for preparing for this new hospital at home type scenario. I think one is partnering with Best Buy, who is trying to reposition themselves as a healthcare company that delivers, equipment into the home and sets them up in the home. Is that something Worldwide Technology does, or do you partner with others?
We partner with others. We have, quite a few OEMs. When we do a project and we build something, we build, the solution. So from idea to outcome. And, we're not holding on to that IP that belongs to our client. That's theirs. but we'll bring in others to help us do it. So, an example is I'm involved with an opportunity right now that is, it's a remote patient monitoring opportunity, but for a federally qualified environment. And what they needed to do is to bring in the technology component, and they have to, again, being mindful of the population, right? So not everybody has an iPhone 12 Pro Max, right? So they may have an older model. So you have to think of those technology gaps. And so and then they wanted the technology partner to be able to, the remote patient monitoring partner to be able to integrate into Epic, has to do that. So there are some basics that they had, and we found one, and they do a really good job. They've worked in these kinds of settings before, and they use cellular technology, so you don't have to tether your this is my sphygmomanometer, my blood pressure cuff here. So you don't have to tether it to your phone. It's cellular, and it just goes right to the cloud. And so, yeah, those are partners we partner with to help bring outcomes to our customers.
Yeah. The home is not a slam dunk. I mean, it's challenging. The logistics of putting technicians in the home, because we did this at St. Joe's. We had a pilot program. We sent our people out to actually set up the technology. And then we learned a whole bunch of stuff of what happens to technology once you put it in somebody's home. We learned how simple the technology needs to be in order for the patients to use it. I mean, there's a whole bunch of stuff we learned in the process, and we didn't make any money at it at least while I was there. We didn't make money at it because we were constantly in the learning phase. But I don't think Amazon's making money at this stuff until all of a sudden they are. It's that kind of thing where you're learning, you get the model right, and then you move forward. So it is challenging to go into the home, and we'll see who's able to set it up. But I think these virtual, I guess they're calling them virtual hospitals. I know that's Mercy's something to that effect. Intermountain calls theirs a virtual hospital, and there's essentially no beds, and there's really no rooms. There's just a command center with an awful lot of technology, and the remote ICU stuff is really impressive. The technology. I mean, they can read the armband on a patient. I mean, it's really impressive.
Right. No, that's the whole nother, because I consider like virtual care like a big bucket, and then big bucket with small buckets. And that's another example. So again, really bringing in that virtual care into the hospital space is pretty awesome. And not just, like I think InTouch Health, for example, they were able to, they had the AV component done. They were able to document, so they can zoom in really, really fine and see, like you said, the monitors and things like that. But the challenge was, we were working with them as a partner back at Decisio, and we said, well, what they want is the clinical information. They wanted to be able to surveillance, populations of patients, and I don't want the white noise. Give me the signal. So if I'm tracking patients, for example, that may be decompensating, and I use a certain algorithm that's accepted within our community, then notify me about that patient when they reach a certain score. And then I can look at that patient, expand it, see all the current data, and then I can make a decision if I need to do an AV consult. So yeah, it's pretty amazing. It's pretty cool stuff.
Well, I'll give you the choice here. We can go in the data direction, or we can do work. Let's do work from home, because I'm curious your perspective on this. You've worked in consulting. You've worked in a hospital setting. I try to explain this to my consulting friends. There's something about healthcare where people being in the same room, people being in the same building has a significant amount of value. And I'm not sure I know a lot of health systems are talking going hybrid. I've even talked to some health systems that are like, look, we're remote now and we're never coming back. But I don't think that would have flown at St. Joe's. I think we would have brought people back at least at least 3/4 of the time, and maybe we've gone to a Friday virtual day kind of thing, but because there was so much value in the culture in bringing people together and those kinds of things, where do you think this is? What are you hearing, and where do you think this is going to go?
Great question. And I like what you bring up. That the last part, when I read that article, I'm like, yeah, a lot of questions there, and those, some to me were a little, I don't know, uncomfortable. But he gets to the last part, and he was talking about culture, in which you mentioned, and I think that's a very important component of the team that you work with. Obviously, when you're in the hospital, you're in the trenches, you're in the ED, you have a certain culture, you're always with these people, and you're fighting the good fight, and you get to know people, very well, as opposed to, again, working from home. So my experience from working from home, I'll give you my latest experiences. So when I started with Worldwide Technology, I was hired remotely. Okay. I have my boss, I have never met except through like how we're communicating. On my team, one of our other chief healthcare advisors, she's a close friend of mine I've known for years. So that's okay. So I have a connection with her, but literally everyone else at Worldwide Technology, which is close to 8,000 folks, I don't know, so how do we build? And then our team, our healthcare team is made up of 4 folks and 4, clinicians. And yeah, with the exception of one, I don't know the 3/4 of them, except for how we're interacting. But not to say that we do connect on different levels, because we're at that healthcare clinical relationship. We have stories, right? We can kibitz on those stories, and we connect that way. However, looking at others that, and I think it depends on the person too. I know I'm rambling on a little bit because I'm thinking, yeah, I'm okay with it. I would love to be with my colleagues and see them more often, for sure. But I get a lot of work done, like in this environment. Whereas when I'm, sitting on the hospital, more on the administrative side of the hospital, you get a lot of interruptions. At least I did.
Yeah.
And a lot of distractions and things like that. And the next thing you know, it's 5 o'clock, 5:30, and you're still behind. It's like, oh boy. So it depends, Bill. I think there's that give and take. And now I'll just add this. And I read the story. I think at the end of the day, when I finished that story, I'm like, it depends on the person's job, in some ways. The cultural thing is important. I'm with you 100% on that. But at the end of the day, you get hired for a position. Now, does that position require you to be there? Obviously, if you're a clinician, in the ED, or, in the, anywhere in the hospital, yeah, you probably need to be there, right? Except if you're doing remote surgeries, you can if you have the technology, you can do it at your house. So as opposed to, maybe one of the IT folks, they don't have to be there necessarily. They could be monitoring the infrastructure from somewhere else and be taking care of problems somewhere else. So I think it depends.
Yeah, and I have heard from some CIOs who are going through the different roles and saying, okay, this role never needs to come in. This role has to come in every day. And they're sort of breaking it down that way and breaking it down. But
so I think HR gets involved with that too, right? I would suspect.
Yeah, I'll tell you, it's hard for consultants, and here's why. Because we're used to this, right? If we're not remote, we're in an airplane. If we're not in an airplane, we're in a hotel. If we're not in a hotel, we're at our client site. I mean, that's how we generally function. I've managed. I was a VP of services for a national company. I had 2,000 engineers, and building culture across that was almost impossible. They ended up aligning themselves more with local markets and those kinds of things. And you ended up with some goofy problems, to be honest with you. I mean, you ended up with stuff where people just didn't get the culture, and they just did. I mean, you ended up with expense reports that you were looking at going, how could you possibly have thought that that was a good idea?
Right.
and the culture's not there. Now, Worldwide has a phenomenal culture. I remember Dave Stewart came out to meet with me when I was CIO at St. Joe's. And when he left, I was riveted. I mean, just such a presence, and his ethos is throughout the entire organization. And there's some organizations that are like that. The Sisters of St. Joseph at St. Joe's is their ethos is, but it takes stewardship. It takes a constant retelling of the stories that the sisters came to Orange County with essentially 67 cents in their pocket, and they started a $7 billion health system that 1/3 of all people in Orange County were coming through their front doors. We all knew the stories because they got retold over and over again. That's it. That's an intentional thing. That's not to be taken for granted. It just doesn't happen.
You hit it totally on the head. I was talking with my team, and we all have come from different experiences, different places, and which makes us awesome, right? So we all have these different life stories, and this is the only place, Worldwide Technologies, that I have worked at that literally walks the walk and talks the talk. Others have mission statements, others have visions, etc., and all that stuff. And you hear it once a year, at the annual meeting or etc. No, this is a daily thing. We live it, we breathe it, and we hold people accountable to it. So, Dave Stewart and Jim Kavanaugh, the founders, they really wanted to have that kind of a company. And I'm so glad to work here. I'm so happy to work here because, people, not only do they hold themselves to that higher level, that higher standard, it's an expectation. So, I like that. I've been in places where it's like, boy, how did you get hired here? And not just it. I'm shocked. And but then here, no, I have the fortune to work with some extremely talented, smart folks, way smarter than me, for sure. I mean, a lot of times the discussions are, because there's a lot of technical discussions, but these are brilliant folks. And again, they're all driving towards, humility, truth, honesty, etc. I mean, it's really, David Stewart's something else. His story is an amazing story too, by the way.
Yeah. Well, and it was the little things too. He sent me a copy of his book, had a handwritten note in it, and I thought, I guess this guy has time. No, he doesn't have time. That's the point. I mean, he took the time to write a really nice note. It's actually, I've moved so many times, I don't know where all my books are. So I apologize. I wish I could just pull it out and show it to you, but I'm sure it's it could potentially be in a box with all my other books. Do we still have books? Do you still have books? Do you have a bookcase?
I do. All my medical books, though, they're in the garage, but like all the stuff that I like to hold books, personally. Matter of fact, Digital Transformation is one that I'm reading right now by Patty. And it's a great book. I'm reading it like a second time now. There's a lot of exceptional nuggets in there. But yeah, I still have books. So to answer your question.
Well, my wife was asked, she goes, well, we need some bookshelves. I'm like, do we really need bookshelves? She's like, well, we have a lot of books. I'm like, we do have a lot of books. I guess we need bookshelves. So I was just trying to see if I'm the only one who's fighting this battle of, can't we just put like 2 Kindles up on a shelf somewhere and say that's our bookshelf? And it just doesn't have the same. I'm not trying to show off that I've read books. I've been in those homes. Have you been in those homes where you walk in and you're like, have you read all these books? And and some of them have read all those books. After you had the conversation, you realize it's like, I don't deserve to be in the same room.
Right. I remember a story. I was visiting somebody back east, and they were at Dartmouth, some family. And again, New England style home, they come from that lineage. And I walked into the library, which was an office, and I couldn't believe the books that they had there. And these were like first editions. And I'm like, I didn't even ask the question, did you read these books? I just assumed they did. And I just felt really dumb, after I walked
First
out.
edition, Edgar Allan Poe. Oh yeah, Uncle
Right.
Edgar. Yeah, he wrote that. That was a good book. Yeah, you
Hey,
never.
but one piece of advice I'd say, your wife told you to build those shelves. Happy wife, happy life.
Yes, and we will probably. And Build is giving me an awful lot of credit. I will be purchasing some bookshelves. I assume they still sell them, so I should be okay.
Awesome.
Well, Eric, this has been a pleasure. I'm looking forward to doing more of these. As if people don't know, the Worldwide Technology is a sponsor, and one of the cool things is they're rotating the various advisors through to do this show with me, and it's great. The last conversation with, and I always get her name wrong. It's Sanaz Cortez,
right?
And
Dr. Cortez.
And now you, and I don't know who they're going to bring on next, but it should be fun.
It's going to be awesome, and we appreciate it. And Bill, I kind of feel like you're a celebrity. I've known you for, followed you for a while, and I think we met way back in your Providence, your St. Joe's days, and we know a lot of the same people, so it's just really nice to have a face-to-face, and hopefully someday I really get to meet you. So
yeah, I'm looking forward to those days where we finally get into the, everybody flies into the city and we all see each other again. It should be great. Well, thanks again for your time. Really appreciate it.
Thank you, Bill. Take care.
What a great discussion. If you know of someone that might benefit from our channel, from these kinds of discussions, please forward them a note. Perhaps your team, your staff. I know if I were a CIO today, I would have every one of my team members listening to this show. It's conference level value every week. They can subscribe on our website, thisweekhealth.com, or they can go wherever you listen to podcasts, Apple, Google, Overcast, which is what I use, Spotify, Stitcher, you name it, we're out there. They can find us. Go ahead, subscribe today, send a note to someone, and have them subscribe as well. We want to thank our channel sponsors who are investing in our mission to develop the next generation of health IT leaders. Those are VMware, Hillrom, Starbridge Advisors, Aruba, and McAfee. Thanks for listening. That's all for now.